Item number 6, AB 253, mental health.
Yes, thank you, Mr. Chair and members. Assembly Bill 253 strengthens the expertise of Mental Health Services Oversight and Accountability Commission and bolsters the link between bond funds that can be used for construction housing for veterans and service dollars that can assist in providing services for veterans in those supportive housing projects. My bill adds 2 additional members to the Mental Health Service Oversight and Accountability Commission to include a veteran with knowledge about veterans' mental health issues and a person with knowledge and experience in reducing mental health disparities. Doing so will help tackle these challenges in these communities. This bill also requires the Department of Health Care Services, DHCS, to post counties' mental health cultural competency plans on a dedicated website and to notify the legislature. The importance of making sure mental health services and outreach are available to underserved communities continues to be a challenge at the local level. The information from the California Reducing Disparities Project indicates communities are not receiving culturally appropriate services. In fact, in some instances, they are not being reached at all because they might require different approaches to bring them into the system. Many of us speak about how much we want to help our veterans, and I know that all of us are very grateful to the service by our veterans and that of their previous service to our country. AB 253 is an opportunity for the legislature to make it easier to help our veterans with existing pots of resources and to allow government to work more efficiently in delivering those resources. Here with me to speak in support of Assembly Bill 253 are Chuck Helgett, Executive Director of the California Association of Veterans Services Agencies, and Anna Hasselblad, Director of Public Policy at the Steinberg Institute, and Rebecca Gonzalez, at the Racial and Ethnic Mental Health Disparities Coalition.
Chair Hernandez and members of the committee. I am Chuck Helgett, representing the California Association of Veteran Service Agencies. CAVS is a statewide association of community-based nonprofit veteran service providers, and we provide veteran supportive services that include permanent, transitional, and emergency housing services, health and mental health counseling, and care and employment services. And we are here as sponsors and in support of AB 253. California is home to nearly 1.8 million veterans, the largest veteran population in the nation. Well over 15,000 California veterans experience homelessness on a given night, and our homeless veterans experience mental health, substance abuse, and employment challenges far beyond their peers. In the areas we serve, the current mental health system does not adequately fund or serve these homeless veterans with mental health issues. While county mental health offices have improved programs for identifying veterans and serving the most severe cases, in our experience, many of our mentally ill veterans are falling through the gaps in treatment between our state mental health offices and the VA. The Veterans Housing and Homeless Prevention Program provides much-needed housing for homeless veterans, but it does not provide supportive services and supportive services funding, such as mental health treatment. AB 253 creates a rational linkage between Proposition 41 housing funds and mental health funding offered in the Mental Health Act. We believe that the linkage makes good policy sense and good fiscal sense, and we urge your support. Thank you.
Good afternoon. Anna Hasselblad with the Steinberg Institute, and we are proud co-sponsors of this important legislation. The Steinberg Institute is dedicated to advancing public policy and increasing political leadership on the issues of behavioral health in California. Housing and homelessness and the plight of veterans are chief priorities of ours. What we know is that veterans make up a large share of California's homeless population, and those a significant portion are faced with mental health issues, substance use problems, or both. After having made the kind of sacrifice they have for our country, every veteran in need of housing should also, at the very least, have access to behavioral health support services. AB 253 creates a structure whereby state and local officials, along with Prop 41 applicants, can work together to utilize Prop 63 resources to the greatest extent possible for the supportive services required under Prop 41. Simply put, these two programs work together. Prop 63 provides the single most significant opportunity to generate sorely needed supportive services required under Prop 41. We believe it is important for public policy to acknowledge and prioritize this reality. We respectfully ask for your aye vote. Thank you.
Mr. Chair and members, my name is Rebecca Gonzalez. I'm with the National Association of Social Workers California chapter. We represent over 10,000 social workers in California with a degree from an accredited school of social work. And I'm also here today on behalf of REMCO, which is the Racial and Ethnic Mental Health Disparities Coalition. And REMCO is another co-sponsor of this bill, and it considers it its legislative priority for the year. REMCO members represent underserved racial, ethnic, and cultural communities around the state. REMCO was formed in 2007 in response to the lack of representation of underserved communities as statewide mental health policy tables, particularly in regards to Proposition 63, the Mental Health Services Act. This bill adds a seat for an expert in reducing disparities on the Mental Health Services Oversight and Accountability Commission, in addition to an expert on veterans' mental health. REMCO has been attending the meetings of the OAC on a regular basis since its formation in 2007. We strongly believe that there is not enough attention given to the issues of cultural competence and reducing disparities. Very few, if any, evaluations of the Mental Health Services Act have paid attention to whether racial, ethnic, or cultural communities are being served adequately. A commission member who will champion and ensure that this voice will be heard at the table is crucial to changing this situation. We also believe that the posting of cultural competence plan component of each mental health plan on the internet and the sharing of these plans with the appropriate committees of the legislature will ensure that these valuable reports will be utilized and that issues around cultural competence and reducing disparities in the mental health system will be a priority. For these reasons, both NASW and REMCO support this bill.
Thank you. Anyone else in support?
Yeah, Chair Member Sean South on behalf of the California Primary Care Association in support.
Randy Hicks, Californians for Disability Rights, in support.
Opposition? Comments? Questions? Senator Roth, motion to move by Senator Wolk, but Senator Roth had a question.
Yes, I'm very concerned about this issue, and we brought it up during some early hearings, and I forget what committee, maybe it was budget, having to do with Prop 41, and unfortunately, when the money was repurposed, it was repurposed and will result in brick and mortar facilities, but no money from Prop 41, it's my understanding, can go to the supportive services, the operational supportive services that we will be promising these veterans when we have these brick and mortar facilities erected and we afford them the opportunity to go into them. Aside from putting some new members on the commission, and this is a good start, and I commend you for it, how do we translate that into additional money out of the Mental Health Services Act pot of money to transitional and supportive housing providers? Is that a fair question?
Well, if I can speak to it, and then if you guys want to add on, you spoke to the heart of this bill when you identify that we have two existing pots, Prop 41 for the housing, Prop 63 for mental health services, and knowing of as many elected officials, whether at any level, city council, county level here, we know that many times we have the capital, but we don't have the dollars to provide services. Here we find that opportunity to merge those dollars together, and this bill speaks to a 5-year commitment. So where there is a commitment in terms of a county as a recipient of Prop 63 and 41 funds to move a project, that those kinds of projects that have merged dollars with a 5-year commitment, that they would be treated with a priority, because if they put it together, they have service dollars there. Beyond that, at least we have a 5-year window to work to identify additional and ongoing resources beyond that, or continued resources for Prop 63, as Prop 63 is a proposition that provides for ongoing perpetuating taxation.
Oh, I see. So there's nothing that requires Prop 63 money to flow to these transitional and supportive housing facilities. We're just hoping that giving priority to those facilities that have the Prop 63 funds, that will incentivize those that have the money to allocate it will do so in that fashion. Is that accurate?
And that the authorizing agencies, state departments, will say, this project has put it together more completely, more wholesome. It's got the wraparound services that we're looking to have in the brick and mortar, and we want to put them under the preferential treatment because they're putting it together.
I see.
And we want to get those projects out sooner, quicker.
I see. Good effort. Thank you, Mr. Chair.
Thank you.
Thank you. Anyone else comment? I believe Senator Wolk moved the bill. Would you like to close?
Just want to respectfully ask for your aye vote. Thank you.
We've got item number 6, AB 253, to pass to Transportation and Housing. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Mitchell. Mitchell, aye. Monning. Nielsen. Nielsen, no. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Nielsen, no to aye.
Nielsen, no to aye.
Currently has 6. We're going to place that bill on call, and we will now move on to item number 10, AB
you, Mr.
648.
Chair, members.
You're welcome. 648, Community-Based Service Virtual Dental Home Program.
Thank you very much,
Good afternoon,
Mr.
Assembly Member. Welcome and proceed.
Thank you very much, Mr. Chair and members, for allowing me to present Assembly Bill 648, which is related to the Virtual Dental Home Grant Program, which establishes a grant program for the dental director to implement funds for teledentistry, in which dental hygienists are able to participate in a program to see patients who might not necessarily be able to access care. And this is an extension of a pilot program that was very successful, and I respectfully ask for your aye vote, and I also have witnesses here in support as well.
Thank you. Please proceed.
Good afternoon, Senators. My name is Kathy Dressler, and I'm with the Children's Partnership. We're pleased to join with the California Dental Association in sponsoring AB 648 because we believe the virtual dental home is an important avenue by which California can provide dental homes and much-needed services, dental health services for children in Medi-Cal. The state auditor's report, as you know, that was released in December, found that Medi-Cal is providing dental care to fewer than half of the children enrolled in that program. Dental disease is the most chronic disease and unmet healthcare need for children in California, counts for persistent pain, many missed school days, and expensive emergency room visits for preventive care. The committee analysis does a really excellent job of synopsizing the program and the goals. And I wanted to introduce Dr. Paul Glassman, who led the pilot program for virtual dental home, to speak about its merits.
Thank you, and I want to thank Assemblymember Lowe and the committee and the sponsors for the opportunity to provide a little bit of background about the legislation. We actually have an historic opportunity now to change the trajectory of millions of people in California who have untreated dental disease and have had so much trouble getting access to dental care. I'm a professor in the Department of Dental Practice at the University of Pacific School of Dentistry, and I've been director of a 6-year demonstration project under the auspices of the Health Workforce Pilot Project in California, a mechanism that has demonstrated the ability to use telehealth connected teams to reach people who normally don't have access to dental care, provide early prevention and early intervention care, and to keep people healthy at a very low cost in community settings, and to connect them with dentists and dental practices so this creates a complete system of care. Some of the regulatory barriers to being able to expand this program were addressed last year in AB 1174. And now we have the opportunity to be able to train and support dental providers across the state and in their communities to help them learn how to use this new system of care. I think we really can make a difference, a significant difference, in the epidemic of dental disease and access difficulties, and reduce the extensive consequences of neglected dental disease, including expenses of emergency room visits, hospitalizations, ability for people to become productive members of society, and the ability for children to be in school and be able to learn while they're there. The training and support from this bill would create a significant step in creating a critical mass of providers learning how to use this new system and addressing these problems and reducing the cost of doing so. Thank you.
Thank you, Mr. Chair and members. Megan Allred on behalf of the California Dental Association, a co-sponsor of AB 648. Just wanted to expand on the comments of the previous testimony and say that the virtual dental home is an innovative and cost-effective system for providing dental care to California's most vulnerable children and adults, and we are excited to see it expanded through this measure and would urge your support.
Jennifer Tannehill with Aaron Reed and Associates on behalf of the California Dental Hygienists Association. we echo the comments that have been made, and we think this is a really exciting next step in all the work that's been done over the last few years for teledental health and expanding this care. So thank you, and we ask for your support.
Chair and Member Sean South, on behalf of the California Primary Care Association, we urge your support of this very important dental access bill. Thank you.
Stephanie Berry with Delta Dental California in support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors in support.
Opposition? Questions? Comments? Yes, Senator Nguyen.
Assemblyman, thank you. This is actually very exciting for me. We did something very similar at the County of Orange, and we got it allocated, and then I left to the Senate, and so I'm not there. So they're working on that pilot over there. I just have a question: is what's the criteria and who could apply for these grants, or is that left to the department?
Sure. Well, I know the dental director will be able to help participate in this opportunity to help facilitate the criteria related to the question that you had at hand. I don't know if Dr. Glassman, you might want to add any additional items.
No, that's correct in terms of the language of the bill. What we're going to hope and recommend to the dental director is that the criteria be to look at underserved communities, and that the methodology be to create a coalition among a given community so that you have community partners, schools, Health Start agencies, dental providers, and others working together to build a system of care that's actually necessary for this method to work, and that you end up with a complete system of care that after the initial training and getting over the learning curve actually is sustainable over a long period of time.
So which I have no problem with. I guess my follow-up question is, are we talking about nonprofits? Are we talking about community clinics? Are we talking about providers? Are we talking about individual dentists coming together as a group? Who as an individual or an entity can apply?
Well, again, it would be up to the state dental director to decide the criteria for the actual grant program, but the experience we had in the workforce pilot project really used all of the above. We had community clinics that were participating, we had private practice dentists, we had actually some of the dental schools, and our own dental school was participating, so that we think there's a lot of opportunity for various kinds of delivery entities. But it's not just the dental part, it's actually a partnership between dental providers and community groups and educational and social service entities that come together to make this work. So we think the answer is hopefully going to be all of the above.
Okay, yeah, because we've done many in my district. When I was a county supervisor, we would go into the school district, the underserved areas, and we would have, it's actually, sometimes we have the dental van. Other times we actually just have, there's actually these mobile ones where you can carry it. And you just put, actually, the child can just sit, or an adult can just sit in on a folding chair, and you can get your dental cleaning as well. So there's different options, and so I just want to because it is limited funds, it's a great program, it's the right thing to do. I just want to make sure that we don't sit here and try to figure out how long the process is going to take before we get the care out there, because getting the equipment, getting the training, getting all the coalitions together can take months. But I don't want us to take months before we even let them know who gets to come together.
Well, our hope is that the 6 years of demonstration we did in the Health Workforce Pilot Project sponsored by the state gives us plenty of experience in learning how to do this, and we're going to try to spread that experience to other providers.
Great, thank you. And Assemblyman, I would be honored if you would let me co-author this as well. Thank you.
Wonderful. Happy to have you.
Thank you. Seeing no other comment, is there a motion? Oh. Senator Nguyen moves the bill. Would you like to close?
Mr. Chair, I just want to also clarify that I also have accepted the committee's amendments and appreciate the support. I respectfully ask for your aye vote.
Thank you. So we have a motion. This is item number 10. AB 648, due passes amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently has 7. Enough to get out. We have a member absent. We'll put that bill on call.
Thank you very much.
Sergeant, can you call Senator Monning? Yeah, let's go ahead and start lifting the calls, and we'll reopen everything back up when Senator Monty gets here so everybody can go. Yeah, well, we're going to start off with the consent calendar, item number 1, 3, 7, 13, and 16. Call the absent members.
Hall. Mitchell. Mitchell, aye.
Currently 8, we're going to place that bill in, oh, that bill is out. Monty already voted for it. He's not going to show up today. No. Consent. Item number 2, AB 216, due pass as amended appropriation. Current vote count is 5-0. Call the absent members.
Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Roth. Roth, aye.
That bill's out too, right? Monty already voted?
8.
That's 8. That bill is out. Item number 4, AB 234, due pass to appropriations. And the current vote count is 5-0. Call the absent members.
Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Roth. Roth, aye.
8-0, that bill is out. Item number 5, AB 248, due pass as amended appropriations. Current vote count is 6-1. Call the absent members.
Wynn. Wynn, no. Hall.
Did Monty vote?
Yeah.
Current vote count is 6-2. That bill is out. Item number 6, AB 253, due pass to transportation and housing. Call the absent members.
Wynn. Wynn, aye. Hall. Monning.
Item number 6.
What's the chair doing?
Aye.
Aye.
Monning, aye.
Current vote count is 8-0. That bill is out. And you and all the rest, Senator Monty. Yes. No, we don't know yet. We still got 3 left, or 4 left. So.
Thanks.
But the other ones were already out. Item number 8, AB 614, due pass to Appropriations Committee. Current vote count is 5-0. Call the absent members.
Wynn. Wynn, aye. Hall. Mitchell. Mitchell, I. Roth, Roth, I.
Current vote count is 8-0. That bill is out. Item number 9, AB 635, due pass appropriations. Call the absent members.
Wynn, I. Hall, Mitchell, Mitchell, I. Roth, Roth, I.
Current vote count is 7-1. That bill is out. Item number 10, AB 648, due pass as amended to appropriations. Call the absent members.
Hall, Monning, Monning, I.
Current vote count is 8-0, and that bill is out. Item number 11, AB 775, current vote count is 4-2. Call the absent members.
Hall, Mitchell, Mitchell, I. Monning, Monning, I.
Current vote count is 6-2. That bill is out. Item number 12, AB 941, due pass to appropriations. Current vote count is 5-0. Call the absent members.
Wynn, I. Hall, Mitchell, Mitchell, I. Roth, Roth, I.
Current vote count is 8-0. That bill is out. Item number 14, AB 1130, due pass as amended to appropriations. Current vote count is 6-0. Call the absent members.
Wynn, I. Hall, Mitchell, Mitchell, I.
Current vote count is 8-0, and I believe, Senator Monty, all the rest of the bills you were already.
I think item 6, Hernandez, the second Hernandez bill, do you have me on that?
That's the one when you were walking in.
Yeah, so you are in everything. So that concludes the business of the day, and we are adjourned.